So we're going to talk about medial malleolus fixation. So bone health in 2023 is a little bit tricky. There's a few tricks. There are some tests, but they're not really that super relevant for us. So if we look at these indirect measures, meaning you're going to do a DEXA scan and then tell me, does that have any relevance to foot and ankle at all? The answer is, when assessing between central and distal sites, the associations were only weak to moderate. So just because you've got a DEXA scan probably doesn't mean a whole heck of a lot about what I'm going to face when I'm in the OR. So I'm really more interested in direct measures that we can bring right into our foot and ankle world, and cortical bone thickness is what we have centered on. Patterson brought this to us in JBJS 2016, looking at ankle x-rays in a DEXA in 167 patients, and they looked at cortical bone thickness, and then they looked at DEXA findings in the hip and spine. The question they asked is, does cortical bone thickness correlate with DEXA? So what they found is that 3.5 millimeters of cortical bone thickness on the distal tibia on the AP view is the threshold for predicting osteoporosis. So inside our normal x-rays, looking at an AP x-ray is we've now got a screening tool that can be useful for osteoporosis, because that's going to then impact us on implant selection and all kinds of other things. So we tried to validate his, so we repeated this again. I presented this data yesterday. And we had 97 patients, all kinds of data, but we more or less confirmed his. And so distal tibial cortical bone thickness was an independent predictor of future reoperation. And this wasn't fracture, this was loosening of implants. So we weren't getting the porous ingrowth when we got less than that. And we really think it's a bone quality conversation.